But I do feel like we have that ability to form that relationship and develop that trust with the patient. And it absolutely has to be like a two-sided conversation. I listen, I give my opinion, and then I ask, what do you think of that? And are you comfortable with that? And do you have any questions about that? We all have to be happy and on the same page at the end of the visit. Otherwise, it doesn't work. And if you don't trust your doctor, you're not going to listen to what they say, and the medicine's going to be ineffective.
Welcome to Suburban Warrior, the podcast that will impact, inspire, and empower you to transform your mindset and become the badass warrior that you are. I'm your host and fellow warrior, Chrissy Pfeiffer, former clinician and corporate marketing exec turned multi-passionate entrepreneur, performance and life coach, and mom to 4 not-so-little warriors. Each week, I will bring you honest conversations with inspiring guests to share their stories of resilience, optimism, success, and simple yet effective strategies so that you transform your thoughts and change your behavior to get the results you want in your life. You will be empowered to take action, warrior up, and believe in you. Let's do this. What's up, warriors? Welcome back to another episode of the Suburban Warrior Podcast. I'm your host, Chrissy Pfeiffer, and I am back this week with another amazing suburban warrior here to share her expertise and story with us. And I am so thrilled to have our guest on today because if it's anything like my last conversation with her, we are going to get into the nitty gritty of treating women in perimenopause and menopause from the source, from a physician who has been treating women her whole life and has really dedicated her entire life to the treatment of women through pregnancy, through women's health, and now through menopause. So let me introduce to you my guest, Dr. Kim Einhorn. She is the founder of the MP Collective, a membership-based gynecology practice dedicated to the care of midlife women with a focus on perimenopause and menopause in Bryn Mawr, PA. The practice is the first of its kind in the greater Philadelphia area and is focused on a myriad of services designed to support women in optimizing their health and longevity. Her approach to care is holistic, evidence-based, and empowering. Each menopause journey is unique, and Dr. Einhorn empowers women with the knowledge and tools necessary to thrive during this transformative stage of life. A board-certified OB-GYN and fellow of the American College of Obstetrics and Gynecologists, Dr. Einhorn has decades of experience delivering comprehensive OB-GYN care. Consistently recognized as a top doc in the Philadelphia suburbs, Dr. Einhorn is a devoted educator and frequently shares her expertise with residents, faculty, and the broader community on a range of topics related to menopause. Her approach to care is holistic, evidence-based, and empowering, designed to support women in optimizing their health through the final third of life. A graduate of the esteemed residency program at Thomas Jefferson University, Dr. Einhorn holds additional certifications in both menopause management through the Menopause Society and obesity medicine. Outside of her practice, Dr. Einhorn finds joy in mosaic art, yoga, hiking, and spending quality time with her husband and 2 teenage daughters. Welcome to the podcast, Kim.
Thank you so much. That was a mouthful. I should probably shorten my bio a little.
I love it. Listen, you deserve a mouthful. You have a very esteemed career, and I can't wait to hear more about your journey and about, why you got into medicine and why you do what you do. So I don't think you need to shorten it at all. It's beautiful.
Well, thank you.
Really
And
amazing.
I am so excited to be here, actually.
Me too. So we are going to get into all things menopause and talk about sort of the state of where we are today with menopause treatment in the world and specifically in our area. So, but first, tell us a little bit about you. Tell us about what got you into medicine and what led you here.
I think I actually thought about this question a lot because my stepdaughter actually is a doctor also. She's in her dermatology residency. And when I asked her the question, like, why do you want to be a doctor? It's not so easy for doctors these days. She didn't have a great answer. And I told her she said, I just kind of always wanted to do that. And I'm like, you know what? That is actually okay because I don't think I could ever really articulate myself why medicine why medicine has always been a draw for me. But I remember from a very young age, I thought maybe I'd want to be a dentist. Then I got my first cavity, and then it was like all about being a doctor.
You're like,
So
forget that.
yeah, you're like, that's not really my cup of tea. Now, I can't say that I don't cause. Now, gynecologists have the unfortunate job of also having a little bit of an uncomfortable exam, which I don't like. But I really, went through college and I was a writer and I was an English major and I loved sociology and I loved learning about people. And I still felt this pull to be a doctor. So I started in my science classes and was not a fan. So I really took some time off to determine, like, UCLA science classes were really no joke. So
Yeah.
I was like, maybe this really isn't for me. And I took some time off after college, about 4 years, and I worked for the heart transplant program at UCLA, got a lot of research under my belt, and really got to see what doctors do. And then I made the decision, I think I just need to go for it, apply to medical school, do it. My uncle, who's a cardiologist, was like, just get through the first years of basic science, and then I promise you, you never have to know the Krebs cycle or biochemistry unless you're going to be doing research, which I was not my thing. I like working with people.
Right.
So fast forward through, my medical school rotations, thinking I was like, probably had made a mistake. Internal medicine didn't work for me. Surgery didn't, I was like kind of like, but surgeons were a little bit cold for me. Pediatric psychiatry was all a mistake. And then my OB-GYN rotation. And by the second day, I was like, this is it for me. I love it. I love taking care of women. I love the mixture of it. You get to operate, you get to deliver babies, which is like one of the most amazing moments of any woman's life. And
Yeah.
you get to be in the office and take care of women through their entire lifespan. I had sometimes a family of 4 generations that were seeing me at the same time. And I
Wow.
got to know their whole family, their whole story, and know them from the time that they, got their first period till the time that they had their last baby. And that is such a gift, and one that really never got old. Being up all night got old, but
I'm sure. Being up all night, being on call.
yeah, no. My daughter wants to be a doctor, and she's like, "What can I do but like be a doctor, but like not be up all night like you?" And I'm like, "Well, we'll talk about that later."
Yeah, yeah, exactly. I mean, that is something to think about because, right, it's when you look forward, are periods of your life where it is a really tough schedule.
There, I would say that OBGYNs, you must know that your OBGYN absolutely loves what he or she does, because it is known to be the worst lifestyle out of any area of medicine, because we function as we're usually up for 30 plus hours at a time. Our call is unpredictable. We really really work, and the stress level is really high, the intensity level is high. And we all go into it knowing that the lifestyle is going to be poor, but the rewards from loving what we do are great. So
Yeah.
I never got burnt out on doing OB-GYN. I did have a little bit of burnout from some certain things about the medical system, but I love my patients so much, and I got so much pleasure and gratitude from just getting to know them, their stories, and being parts of their lives. And then, as I started getting older myself, and most of my patients were transitioning out of the baby having, era into the perimenopausal era, I found like my second passion within OB-GYN, which was, care of women in midlife and perimenopause and menopause, and what a special time this is for women. I say special, most people are probably groaning, but it really is a time that's special for a doctor, because there are a lot of needs that we really can, with very simple tools, change the course and trajectory of their perimenopause journey and their health for the better. So
Yeah.
I surprisingly found this to be something that I love, and I never get tired of talking about, even though I talk about it, dream about it, sleep on it, like literally 24/7 every day.
Yeah. So I know last time when we had a conversation, we were talking about how, you did love delivering babies and working in OB and being there for your patients for these very special moments. And now sort of you're in this transition where you're moving to your own practice, specializing in menopause and perimenopause care of women, which again is it's still a wide age range, right? Because perimenopause can really start in your mid to late 30s, which a lot of women I don't think realize that, that's a topic we can get into maybe in a little bit, how a lot of women start to have health issues in their late 30s and not realize, especially all these new health issues, not realize that it's related to the hormone disruptions during perimenopause. But tell us a little bit about sort of that decision for you, leaving a practice that you have loved so much and dedicated your life to and were treating generations of women, to now moving to your own menopause, perimenopause clinic.
Well, the decision for me was a really hard one because I spent about 18 years at that practice, and it was, I mean, after you spend that long, these relationships that I developed with my patients, many of them became my friends. I knew their stories. I had treated them through, trauma and my own trauma. I mean, most of my patients know like way more about me than they do about most doctors, because that was a way of like
Connecting.
exactly. Like I would go through things, my patients would go through things, and I think the ones that appreciated the sharing remained my patients, and the people that didn't probably did not. But I do think that the problem with most healthcare these days, and I don't want to be too negative about it, but it really doesn't evoke a lot of positive feelings from me. The problem with doing healthcare these days, and especially menopause care or perimenopause care, because really I think perimenopause is where most of the problems come up. And once you do hit menopause, and we can talk about this later, you do get into a more smooth sailing clip basically. But perimenopause, you can just hit you like a freight train. And women would come in for their annuals, and rightly so. Like, I don't blame them for thinking this at all. They save up their questions for me because they have an appointment, they waited for months to get it, and they're ready to hit me with all of the menopause questions and the perimenopause questions. When we also have to do a breast exam, we have to do a pap smear, a pelvic exam. I have to ask them all their standard screening things that, that really, and in a 15-minute time slot, that this is what I'm told I have to see a patient in. And I'm also told that I have to see patients in less than 15 minutes because whoever you're working for may want you to be double booked every 45 minutes or every hour or something like this.
Right.
So in my opinion, an annual shouldn't even take 15 minutes. And a perimenopause visit should take about 60 minutes. And that's if you do it right, because it's not just about what are your periods doing? Are they irregular? Oh, yep, that's perimenopause. Don't worry, you'll be fine. Call me if you have any other problems or something like this.
Which, by the way, I'm laughing, but that is what probably 85% of women hear as,
Well, ever since starting my small little Instagram account, like I get messages from people I know and from strangers like all the time too. And they are telling me these stories. They are telling me, I went into my doctor and I scheduled it for a perimenopause visit. Even they did the right thing when I tell people always just schedule your visits for a problem visit that should take at least 30 minutes. Make sure they know it's for perimenopause so your doctor can like kind of get in that mindset. And, they were saying, yeah, your periods are starting to space out. You're starting to get like, a little joint pain, perimenopause. It's fine. You just get through it. And I'm like, this is not what women need to hear at all. They need to have all their symptoms heard, and they need to be acknowledged. So my frustration, going back to your point, was that I really feel like every doctor, I think, wants to be a good doctor. And being a good doctor involves having the time to listen to your patient and having the knowledge to be able to treat them. So, the time becomes a problem in most healthcare systems accepting insurance, whether you're working for a private equity company like I was, or whether you're a hospital employee. I mean, everyone's being told, see more patients in less time. And that's the problem. That's why we have a lot of physician burnout. That's why it's so hard. It was really hard to keep my patients in a primary care doctor in this area, because all the primary cares were just not able to take care of complicated issues in 10 minutes. So they go concierge. And a concierge model is unfortunate in that it's not accessible to everyone. And I acknowledge that. And I, have Dr. Guild about that. But it is the way to allow me to take the best care of every patient that I see. And everyone is happy in that model. Patients love to be heard. They love to be listened to, understood, and not felt like rushed out the door, and not feel like their doctor is anxious too. Like I never would see patients in 15 minutes if they needed more time. I was routinely running 45 minutes, sometimes an hour late. And my patients were very kind and understanding about that, because they know when they needed the time, I would give it to them. But inside, I was like, I'm going to be apologizing for the rest of the day to every single patient after this, because it's not right to make patients wait either,
Right. Yeah,
So
absolutely.
Yeah, so like this practice is really just the birth of a dream that I've had that allows me to really get into everything that this patient needs. Whoever I'm sitting across the desk from is going to be asked questions about obviously their menopause symptoms. I want to spend at least the first half an hour just listening to everything that they have to say. But then I want to get into what is their nutritional status? What are they eating? What was their last 24-hour food log? What is their functional, like their fitness status? I have a body composition analysis scale that, like, my $10,000 scale that just got delivered to my house yesterday because my office is being renovated now. So this is going to tell me like a more thorough picture of someone's health, because I'm going to know what percentage of their body is fat mass, what is muscle mass, like lean body mass, where is that fat deposited? Are they accumulating visceral fat, which happens in menopause? And we're going to go over their fitness. And if they're perfect, great. If they're not, we're going to talk about what they need to add in to maintain their muscle mass. We're going to talk about what is going on with their stress level. Like, where can we improve that? How can we improve that? And we're going to offer things in the practice to help with that. Meditation, yoga, like group sessions, so that we have a sense of community. And, then what's going on with the sleep, like the four pillars of health
Yeah.
medicine is a wonderful adjunct, and that's my specialty. Knowing how to be a hormone whisperer and get you on what you need to be on to really thrive and feel best. And sometimes that's not just the first try. Sometimes it's a trial and error, but also really looking at you and knowing you as a whole person, knowing what's going on in your life, so we know what to how we can optimize. And then finally, really just taking a more proactive, preventative view on health versus what I call band-aid medicine, which is what we all practice these days, which is
Yeah.
like slapping band-aids on cuts, putting out fires that have already gotten too big to the point where you're just kind of remediating, when really, if you have a doctor that has the time and the inclination to be a little bit more preventative, like maybe you need earlier bone density scanning, maybe
Yeah.
you need earlier cardiac scanning, like you should have a calcium score. You should have a
Right.
bone density scan well
You mean
before.
like you should have a DEXA scan before 65?
I know, it's so funny, right? Like how many
I mean,
women,
it's crazy.
there
It's
have been
crazy.
studies that show that women in their 20s and 30s already have low bone mass.
Yeah.
And this is something that can absolutely, it's a preventative thing. Like cardiac disease can be prevented.
Yeah.
So we just need to get to these people early, and that's just not the model in today's medicine, and it should be.
Yeah, I mean, we have a sick care system instead of a health care system. That's sort of what it has evolved into.
Right.
And going back to your point earlier about the concierge medicine, I think you hear a lot of people say things like, "Oh, so and so went concierge," it's about the money, but it's really what I think people don't understand. It's not about the money. It is about you having a more empowered way to treat patients, right? Because now it's your autonomy, and you can make the decision about how long you want to give each patient, and looking at each patient as a whole, getting to the root cause of what is really happening in someone's body. And I feel like, our system is very much a symptom. Let's treat the symptom, treat the symptom, treat the symptom. And I know that's how it was for me in my own perimenopause experience. And there were so many medicines being flown at me and antibiotics being flown at me for symptom treatment that it just kept making me sicker
Right.
because it was never getting to the root cause of what was really happening.
Right.
And even with my medical background, I still didn't realize it then. I didn't realize, like, wait, this isn't the right model. I should, I actually wanted to get to the root cause, but was really I struggled finding a physician that would help me do that. I think this is, going back 10, 12 years. So I think this is a wonderful evolution to, as an option for patients and specifically for women, that this new menopause care is becoming a thing, just because, and we need more and more practitioners, because
Right.
there's only 2,300 certified menopause specialists in all of the United States, and millions of women are in
And
menopause
exactly 6,000 women every
a
day get
day.
menopause in this country, and like 1.8 million in this country. It is a lot. And, the problem really all stems back from some unfortunate interpretation of research that was done, back in 2002. And of course, probably most people at this point have heard of the Women's Health Initiative. And the misinterpretation of data, or I should say the inappropriate extrapolation of that data and how it was interpreted. And it really scared women and physicians alike off prescribing hormones that really, really are the gold standard to help women through menopause or the menopause transition.
Yeah.
And what that was a trickle down to, if there's no solution to your problem, then why are we going to teach it in medical school and residency? And so every doctor that is in my generation, like I was already in residency after the WHI came out. And so we spent no time talking about menopause care or perimenopause care. And it's the time that is the most pivotal, crucial time in a woman's life that I think where health can be impacted for the better if you have the right care. So I do feel like this is just a grassroots movement with the change of generation. Like our generation is not a baby boomer. We're not our parents' generation, who I think maybe, had that initial fear struck into them about breast cancer and hormones giving you breast cancer or starting cardiovascular disease or dementia, all the things that really have not panned out when you take a much finer tooth comb to the research. And we can talk about that now or at another time. But really, they were scared to go on it, and doctors were scared to put them on it. And then no future doctors got trained. So now women in our generation are like, hey, I don't feel good and I don't really like the way I feel, and I want treatment. And I think that it's coming out that way and in social media, and it's forcing doctors to have to learn about it. So like I'm giving a Grand Rounds lecture. Grand Rounds is a lecture that physicians give to other physicians. And so in the beginning of June, I'm giving a lecture to all of the mainline health physicians on menopause, identifying symptoms, and how to treat. And it's my hope that I have a lot of knowledgeable colleagues, and there definitely are a lot of doctors out there, gynecologists on the mainland that are very proficient in treating menopause. I'm hoping to add more to that number and get everyone a little bit more comfortable with like identifying symptoms. Like you mentioned before, it can start in your mid 30s. And I will tell you that I'm guilty myself of having patients come in years ago before I was able to self-educate. Someone would come in at 35 or 36 and they're like, my periods are starting to become irregular. Is this menopause? And I'm like, no. Not menopause.
No.
You're still getting periods once a month, like you're fine. But really, we do have what's called straw staging, and that will tell you that this SWAN study, the study of women's health across the nation, really looked at women, a longitudinal study that looked at women starting at age 35 through the menopause transition, and it can start that young, and it really starts by having periods spaced out, and the technical definition is 7 days, plus or minus 7 days, and I noticed that was a common theme, and my apologies to any of my patients that I said that to. I don't feel that way anymore, and I'm, happy to make amends.
Well, it's interesting that you say that too, because if you go back and you look at that time, I mean, so for me, I was like, I'm 50 now, so it was like 12 years ago, like 38, I started to have like irregular, like really heavy periods. And I had started to have really bad gut issues. My joint pain started, like things started, but I never really thought it was perimenopause because also, I mean, we didn't have period trackers on our phones back then. Like, so if something was like plus or minus 7 days, a couple days here, a couple days there, I feel like the women of that generation, if you're talking 10 years ago, we tracked it, but I mean, we weren't like to the day like women are now, because their phones are saying, bing, you should be ovulating, you should be getting your period, you should be this, So it was just a different
wearable devices that tell us everything.
Everything, exactly. So it was definitely a very different time when we weren't really thinking about all of that. I wanted to go back to something you said. You were saying about how because of the WHI, no future doctors got trained. And I think that that's such an important statement, because I think it's important for women as patients to understand when they're walking into a physician's office. I think we go in a lot of times with an expectation of, this is the doctor, they're in their white coat, and they should be knowledgeable and they should know it all. And I'm very guilty of that too. Just, having been a nurse, my first job was at Johns Hopkins Hospital. The doctors, they knew it all. It was very much put them on a pedestal, and what they say is gospel, and that's how we follow their direction and that sort of thing. And I think a lot of people still think that way. what would you say to women who are going into physicians' offices with symptoms, whether it's their gynecologist or not, maybe it's their family practice endocrinologist, GI, whatever, and they're sort of not really getting the answers that they need, or maybe they're not feeling heard, or maybe, there's that voice in them saying, I don't think I'm okay, even though the doctor said I'm okay. Like, what would you say to those patients if they're not really getting maybe the care that they feel that they need or the answers that they need from their physicians?
I mean, I hate to say it, but I think they need to find another provider.
Yeah.
And this is not to say that their provider is a bad doctor, but everyone has limitations. You can't be everything to everyone, and not every internist or gynecologist has the menopausal knowledge. I think that's changing, but I do think that there are ways to get in touch with menopause providers. There's menopause.org, which is the Menopause Society website, and they do list physicians that are either certified, or whether they're certified or not, have listed themselves as menopause knowledgeable providers. And then sometimes I even refer people to Mary Claire Haver's website, which are physicians that have been recommended by her readers or followers. So it's not, they're not like necessarily certified in menopause, but for whatever reason, a patient thought that they got really good menopause care. So, and there's also telemedicine companies like MIDI Health or Genev that have menopause certified practitioners that know a lot about menopause. And I do think that it's really important to follow your gut as a patient. If you feel like something is wrong and your provider isn't able to instill that confidence in you that their answers are the right ones, then it's just as easy as, or it's not so easy these days, but getting a second opinion. There's nothing wrong with that. I was always happy if my patients got a second opinion, because if whatever I was saying, they needed to hear it again, or if they didn't like what I was saying, like, they need to feel comfortable, and that's the most important thing. A patient needs to feel comfortable with the person in charge of their health. Their health is the most important, the most valuable thing we have. So there are a lot of doctors around. You might have to wait a little while to get in to see them, but you have to sometimes be your own health advocate.
Yeah. Yeah. And view it in a little bit of a different way as like a partnership. Mm-hmm. Right? Like, to your point where you have patients that are coming in, you're establishing a relationship with them, you're spending an hour with them, you're getting a whole health history, you're understanding their whole lives, what's happening with them, what are some factors that are happening in their lives, like, and it really is a true partnership. What works for your patient, what doesn't work for your patient, versus just a dictatorship.
It should never be a dictatorship. It absolutely should never be like that. And I do feel like gynecologists have that special opportunity to form relationships with their patients that women don't form with other doctors. I've seen it myself a million times in my own practice. I'm not sure if it's because we delivered the babies or because the exam itself is so private and vulnerable and intimate. But I do feel like we have that ability to form that relationship and develop that trust with the patient. And it absolutely has to be like a two-sided conversation. I listen, I give my opinion, and then I ask, what do you think of that? And are you comfortable with that? And do you have any questions about that? And, we all have to be happy and on the same page at the end of the visit. Otherwise, it doesn't work. And if you don't trust your doctor, you're not going to listen to what they say, and the medicine's going to be ineffective.
Right. Absolutely. I think that's such great advice. Okay, so your practice is opening shortly. Tell us.
It can't open soon enough. I have patients calling me every day, and they're like, I need hormones now. And I'm like, I'm sorry, it's September, but get on the list. Yeah.
I know. Get on the list, right? That's amazing. And I know that you do have a list that is building and building for your practice that is opening, which is very exciting because, again, it is such a much needed area of care. Let's talk about perimenopause for a little bit because we mentioned that earlier, and that really is, I feel like that is the time that is the most chaotic, and so many unknowns start to happen in a woman's body. And I also think women are starting in maybe their late 30s or 40s or whenever it is, and they're not thinking menopause, right? They're not thinking that it's a hormone disruption that could be causing a lot of their symptoms. And now we know there's about 36 documented symptoms of perimenopause/menopause, and I'm sure that list will continue to grow of symptoms and what we could be experiencing. But Tell us a little bit about sort of, you even said yourself, like you didn't really know at the time. What was that process for you, like figuring it out that it is menopause? And maybe explain a little bit, why are our bodies just in such a state of chaos and, up and down and craziness during this time and affecting so many systems in our body? Yeah, it's not just like,
Right.
hot flashes and weight gain, which I think that's what women think of. Oh, menopause is hot flashes and weight
Hot
gain.
flashes and night sweats and
Yes.
losing your period. Those
Right.
are the symptoms that patients identify and doctors identify. And I've had a ton of people call me or message me, and they have 10 symptoms that I would label as perimenopause symptoms, but because they have not either lost their period altogether yet, like gone that full year without a period, their doctor doesn't think they can be treated for menopause, or doesn't recognize it's menopause unless, you have those hot flashes. Like a lot of people, for instance, okay, will have, the joint aches and pains, chronic fatigue, mouth burning, like a million different things. But if they don't have the hot flashes and the night sweats, no one is thinking it's menopause, and that's completely
Right.
wrong. And I will say, so really what happens is that our body likes homeostasis. Our body likes stability. It likes predictability. The times that we are the most like labile, or like, I hate to use the word crazy because that's been applied to women way too many times inappropriately, but like we don't feel great when our hormones are doing unpredictable things, namely puberty and then again perimenopause.
Yeah.
Once we pass through perimenopause, this research shows that we actually feel much better. There is a light at the end of the tunnel. And if you've ever read Lisa Mosconi's book, which is The Menopause Brain, she does tremendous work, actually, like, MRI images of the brain through perimenopause and menopause, but even talks about what the happiness scale, that women are happier in their 60s after they've gone through perimenopause than they were in their 40s, 30s, and 20s, which is like remarkable, which is what I tell women, that like there is a way to totally thrive through this period, and you don't have to feel bad. Like I feel better than I felt in a million years, and that's because I got the right care and I'm doing the right things for my body that I was not doing many years ago. So
Right.
really, like what happens is that our ovaries just lose, we're born with we're born with a number of eggs. We lose those eggs throughout our lifetime of ovulating. And once our ovaries are depleted of eggs, called oocytes, then our body really loses its ability to ovulate, to put out estrogen. And our estrogen goes from a period of like a very predictable rise and fall every month with our periods and our ovulation to a very unpredictable, what I always called roller coaster, because
Yeah.
it's up, it's down, it's higher than it was before perimenopause, and it can be low in menopause range from an hourly basis to a daily basis to a weekly basis. And actually, I just attended a lecture last night where the lecturer called it the stock market instead of the, like today's stock market instead of a roller coaster. So I'm like, that's also a really good analogy. It's like the stock market today, or it's like a roller coaster. And it's the unpredictability and the extreme fluctuations that really cause the majority of our symptoms, especially the cognitive ones. So like you can start feeling like, don't ever think that these symptoms aren't menopause. And I'll list a bunch, like the cognitive ones, like the brain fog, the forgetfulness, the memory, feeling just like sludgy, the musculoskeletal symptoms like joint pains, frozen shoulder, like my right knee started hurting so badly and I didn't realize it. And then it gradually went away once I was on estrogen for a little while. I thought I just had arthritis. It can be arthritis, but when patients come to me with some of these symptoms and I can clearly tell they're perimenopausal, I say, how do you feel about a trial of hormones? We'll see if it takes care of it. But like the anxiety levels, the sleeplessness, the disturbed sleep, for a myriad of reasons, it's all related. It can be all related to hormones. And I'm forgetting a million other ones, but I have a whole slide, and all the doctors laugh when I put the slide up of all the symptoms, because it's like a bunch of bubbles that like there's not even room. They're all overlapping because there are
Right.
so many symptoms. And really, we have estrogen receptors everywhere in our body, from our skin to our hair follicles, to our brain, to our muscles, to our joints and our synovial fluid, and in our heart, like palpitations, for instance. Guess who went to a cardiologist because of palpitations for, when I was like 48?
Yeah.
I was sitting next to her in the lecture last night, and I'm like, remember, that was my perimenopause. So,
Oh my gosh,
all
that's
these symptoms,
hysterical.
all
Yeah.
these symptoms, and even a gynecologist was like making sure that her heart was okay because it could have been, it probably
Right.
was perimenopause, but
Yeah.
it's not solved with hormones. Then we have to look into what else it could be and figure it out.
Right. And to your point about estrogen receptors everywhere in our body, some of the other symptoms are like dry eye, dry
Yes.
skin, dry
Try
vagina,
everything.
which then leads to, sexual dysfunction, loss of libido, which are all very impactful things,
Right.
for women in midlife. And to think if you were to experience one of these, hair loss, UTIs, genital urinary symptoms, but if you were to experience one or two of these symptoms, it's really disturbing and can disrupt your life. But when you're
But
experiencing
to
like
feel them
15 of
all
them,
at the same time. And it's true.
yeah,
And this is an area where we can be more preventative about women's health.
yes,
Because if I told you that, like, let's take the genital urinary syndrome of menopause, which is
yeah,
really vaginal dryness, which evolves into painful sex, which then snowballs into much more painful sex,
yes,
and recurrent UTIs. But if I told you in perimenopause, before you were really having that many problems with it, that I could just give you a little bit of harmless, really harmless vaginal estrogen, and you could use a little bit of it every week, and you probably will never have to go through that. Maybe you'd want to do that versus waiting for the symptom to happen and then having
right.
to treat the problem, which is much more difficult to regain function than it is to maintain function, basically.
Yeah, prevent it rather than have to treat it. And
Exactly.
especially for women who are experiencing recurrent UTIs and
Hmm.
they're on antibiotic after antibiotic. I
Hmm.
mean, being able to put a little bit of estrogen, there to help treat that and or not experience those recurrent UTIs. I mean, that's huge. That is saving your gut microbiome from all the, it's just like there's such a snowball effect. Like we talked about with painful sex, obviously women who have, dry vagina, low libido, or painful sex, therefore then maybe they don't want to have sexual relations as they were before, or they're feeling, it comes to a whole feeling of not feeling like yourself, feeling insufficient, feeling not enough, like, right? And then all of these symptoms affect your sexuality to begin with, and then all of a sudden that's affecting your relationships. I mean, I forget what the percentage is, but the divorce rate is the highest for women in this stage of our lives,
It
and
is.
so is the rate of suicide, which is absolutely unacceptable and
I mean,
unbelievable.
it is any woman that's had a history of depression, anxiety is very vulnerable to having those feelings reoccur during perimenopause. And I hate to always draw it back to hormones because there's many other non-hormonal methods. And actually, one of the things that I study the most is how to treat cancer survivors because they most of the time are not always candidates for hormone replacement therapy. Depends. Sometimes they might be, but they really need a lot of help. And there's a lot of things out there to help women through this phase. And you mentioned like how it can snowball into low libido. Like if I had a penny for everyone that came to me with problems with their sex drive and libido, it is related to perimenopause. It is also not related to perimenopause. It starts happening sometimes as soon as after you have kids. You know what I mean?
Right.
Because it's so
Yes,
multifactorial. I have a
exactly.
million books on my nightstand all about this because it's so complex. And another reason why I'm just so looking forward to being in this new model of medicine where I can have an hour long conversation with you instead of just telling you go read this book. You know what I mean? I'll give you
Yes.
the book anyway, but like I want to be able to tease out, are you tired, are you stressed, do you need my favorite thing, which is HRT, which is husband replacement therapy, like, are you having financial issues,
Yeah.
did you gain weight, do you feel bad about your body and not want to take your clothes off, like,
Right.
are you
Right.
having communication issues, are you not sleeping, there's 20 reasons. Libido
Right.
is multifactorial. It's not usually related to your hormones. There is hormonal assistance that we can offer you, but really, like sometimes just the routine, like everyone's talking about testosterone these days, but we start with estrogen and progesterone, and sometimes that's as good as that's like female Viagra for women. So
Yeah.
you never know. You have to start feeling better, and you have to start taking off those little checking off those little boxes one by one to really see, how we can like get at the problem. And it is
Yeah.
complicated, but it's solvable.
It is. And I feel like that whole area for women, especially like in the clients that I work with, it's always like the last thing I think that they bring up because, as women, I think we think like, oh, well, it doesn't really, I'll get to that last, or my sexuality and my pleasure. We're so used to making sure everyone else is okay in our lives, especially through our childbearing years and bringing up our children and raising them and making sure everybody's happy and putting our own needs sort of last. But then we get into this phase of life where all of a sudden maybe we can start putting ourselves first, and we have the ability and the time, and then all of a sudden we don't feel good. and I feel
Not
like
there, right?
and then it's like damn, what happened? But I feel like just women in general tend to put those symptoms, put them last, when really, to your point, they're so multifactorial, but they're so important to your own joy and vitality and finding excitement and pleasure in yourself, and then being able to share that with someone else, or share it with the world, but it's really, I feel like, something that we put last as women, and we have to start realizing that no, it's okay to talk about it, and it's okay to start making it a priority.
Yeah, I mean, I think, well, I see why you're a wonderful life coach, because you're like, this is the gospel here. I mean, we really, I think it is ingrained in women to
Yes.
always take care of everyone first, because we're the ones that grow the babies. Like,
Right.
we grow a human out of nothing, and we're responsible for that baby for 10 months inside us.
Yes.
And we're given that gift because we have that instinct, right?
Yeah.
So, and that doesn't go away when the baby's born. That is carried on forever, whether it's your children, your husband, your family, at this age, our parents, you know what I mean?
Yeah. Yeah.
So we, like, part of what my job is to, work with my patients to find where they can give themselves the time for self-care, because we do have the times now. I mean, listen, I'm really busy, and I get angry at myself because this week has been incredibly stressful with, like, not stressful, good, but like, I'm signing a lot of patients up for my practice now, which means I'm on the phone a lot talking to patients, explaining about the practice, and I actually didn't get to work out this week, and that's really unusual for me. And so, I'm coming down on myself, and I'm being really hard on myself. We have to make, but I'm giving
Yeah.
myself grace now. I'll get back to
Right.
it. But we have to make that time to take care of our needs. And that includes the all encompassing hard thing of meal prep sometimes, or ordering from a meal delivery service, getting our exercise in, no matter how small or how little.
Yeah.
Anything counts. I do a lot of research into fitness and nutrition through my work with obesity medicine, and it's not an all or nothing thing. If you can get out for a 10-minute walk, that's better than not doing it.
Yep.
And there are proven benefits to anything. If you can, like, make a tiny little change in your diet, but, like, eat the bad thing one day, but make a decision not to eat it the next day, that's also good. And you have to,
Yeah.
like, meet women where they are to get them to make these small, sustainable changes that will be able to be carried out for the long term. And then you upgrade little by little by little, and nothing gets overwhelming. And it's a process. It can be a years long process to get to where you really need to be, and that's okay.
Yeah. Yeah, no, I totally agree. I think you can't wellness your way out of a bad diet and a sedentary lifestyle,
Yeah.
right? But to your point, it is small steps that you can make that make a big difference. And throughout, it's every day, every day, it's little tiny steps that matter. And I live by an 80-20 rule, right? If I am really good 80% of the time, then 20%, and usually it ends up being during the week. I try to be really good, and weekends, I treat myself, I eat the ice
Yeah,
cream,
like, if
I
you
have
go
the
down,
drinks.
if you go down the shore over the weekend, you need to
Yes,
go get ice cream. Like, I have a
exactly.
lot of patients that tell me that they're like, I'm really good during the week, but I'm getting
Yes.
my ice cream on the weekend. It's
Yeah.
summertime. And I'm like, that's
Summertime.
true. I was sitting at Suburban Square with my daughter having dinner outside, and a woman in her probably mid 60s walked by, thin and fit, eating ice cream. And I'm like, that's what I like to see. I embarrass my daughter,
Yes.
but I'm like, that's what I like to see. Women enjoying themselves. Like, it's okay
Exactly.
to, like, yeah, when you can't make a sustainable change if you're thinking in all or nothing terms. You can't.
Exactly. Exactly. Yep. I love that. I love that.
And this is coming from someone who did have a weight problem. I'm still, like, trying to work towards my goal. and, spent many years exercising a lot, but then many more recent years, not at all. And so I've been there, I've done that, I've been the patient, I'm the doctor now, and it's like, I get it. And I have tried to correct my faulty thinking about like very low calorie diets
Yeah.
and diets that exclude, that are very exclusionary. Like that's not the way to go. And that's not how, that's not the way to success.
Yeah. And don't you think it's like, it really is a complete shift in perspective to, from the restrictive diets and, don't eat this and don't eat that, or, and counting calories and all that kind of stuff, to more of a perspective of truly nourishing your body, like at the cellular level, like
Yes.
really giving your body the nourishment that it needs at the cellular level. And when you really think about, how we are just these energetic beings made up of all of these different cells, and but when it's such a beautiful thing when you think about what we were meant to be eating, right? We're meant to be eating fresh
yeah.
vegetables, fresh fruit, things that whole foods. And when you think about it, like that's what my body's craving and that's what it needs. I think it's a whole mindset shift that takes you away from like, oh, this is bad and this is good, to really just listening to your body and sort of honoring it with whole foods, and then, treating yourself to some guilty pleasure sometimes.
I mean, your 80/20 rule is that. So
Yeah.
I do believe that. And when I talk to people, when I'm doing my education, I tell them that it should be a mentality of adding in versus taking out, right? So
Yes.
if you're
Love that.
adding in, if you're adding in, you're trying to get your whole foods in, like you want to try to get as close to your protein goal as possible. You want to try to get as close to your fiber goal as possible. Usually that's going to be through fruits, vegetables, and whole grains, right? So you want to add those in. And if you're adding those in, there's going to be a lot less room in your stomach for the ultra processed other things, right? And you're going to have less cravings because you've now met your body's nutritional needs, right? So that's the thing. Adding in and the mindset of that is so much more palatable than I can't eat this. I can't eat that.
Yes. Yes.
That's an awful way to feel and an awful way to think.
Absolutely. And it's so much more empowering. Yeah.
It is
It's
empowering. Like I can eat anything. Like I can eat whatever I want, but I want to make sure I've gotten in the good stuff first.
Yeah.
Like there's even, we just had a lecture at the obesity medicine gathering last weekend, and it was even about how we order our foods and our meals. Like, eating the vegetables on the plate first, then eating the proteins, and then eating the whole grains, because our bodies may process that order. But I think in my mind also, it really just means like you're filling up with the things that are nutrient dense, that are filling and nutrient dense at the same time, versus like the less dense, nutrient dense foods that are, like not going to fill you up. So you're getting all these things first before you go to the things that are like the less nutritious, maybe, you know what I mean? But anyway, I mean, it's all, there's, no one diet that's actually ever been proven to be better for midlife or better for weight loss. We know what diets aren't good, which are fad diets, which are very low calorie diets. But like diets that include the whole foods, like, everyone talks about the Mediterranean diet, it's perfect, but there are many other diets that are really just as good, as long as you're not starving yourself, and as long as you're not doing something unsustainable and you're including those whole foods, the vegetables, the fruits, the proteins, the whole grains, you're getting what you need.
yeah.
And really, if you're talking about weight loss is really through diet. It's not so much through exercise. But exercise is the key to longevity and living the healthy life. That's the thing. You can't have one and not the other.
Yeah, absolutely. Oh my gosh. Well, Dr. Einhorn, I feel like I could sit here and talk to you for hours, because you are so knowledgeable and so passionate about what you do. And I feel like we could keep going on. We're going to have you back on the podcast.
We have to do it again, and we'll focus on like a few different things. Like I felt like it was almost hard narrowing down what I wanted to include in my own practice. Like we have the fitness studio that we're building because I feel like I can't just tell a patient like go to the gym work out, because I've been that person and my doctors have told me that, and it's not making me go. But if I have it right there for you in the practice with a really knowledgeable educated trainer that's not going to injure you and that's going to be understanding and meet you where you are, and you can have it right there in a very non-intimidating environment, and I'm telling you, do it, like maybe that will make people work out more. If I have a nutritionist in the practice that's going to be like kind of looking over your meals with my guidance too, like that's maybe going to make the difference. So despite people that know more about business than me, we're including that all in the practice. It's all in the model, and
I think it's amazing because I think every woman needs a team. I think every woman needs a team. And, it's all part of this phase of our midlife. It's community, it's team, and you kind of need a multitude of different practitioners to focus on different areas of your care. And I love that. I love that you're including fitness and nutrition, which are, like you said, the pillars of lifestyle and healthcare in along with your practice. It's so important. So it is truly a one-stop shop, which is amazing.
I'm looking forward to it.
Good. Okay. So tell my listeners where they can find you.
So you will be able to find my practice in Bryn Mawr. We're like right across from Bryn Mawr Hospital in this beautiful little cottagey building that we're going to make beautiful so that you feel special when you walk in and feel safe and feel like you're where you need to be. Right now, I am already enrolling patients. My website is thempcollective.com. So that's like and then mpcollective.com. So all the information's up there under the page that says enroll. You can see all the different tiered memberships or the prices for consults, and you can enroll and pay there. You can you'll get a call from me because a lot of people that are enrolling really have a lot of questions either before they enroll or after. And we call. I've been on the phone with patients from anywhere to 20 minutes to over an hour just talking about it all. And you can find me on Instagram at Kim Einhorn MD. I also am on TikTok too, because that's kind of a fun place to be.
Yeah.
Kim Einhorn MD. And then people that don't have that seem to be finding me on Facebook. So what used to be just pictures of like my kids and my dogs is now all medical, a lot medical too.
I love it. Oh, that's great. We will make sure that we link all of that information for your website and all your socials in the show notes so that patients know exactly where to find you. I want to thank you so much. Oh, go ahead.
Can I say one thing?
Yeah.
I am teaching another mainline school night class. So people that are not going to be patients or can't afford to be patients, I give a lot of free information out. So my mainline school night class starts again in October. It's like 6 hours of me just like telling you what I would be saying in the office. It's not personalized medical care, but it's definitely, information. There's that. And I'm only taking 300 patients. Like I'm capping out. That's what's going to allow me to spend a lot of time with patients. So, people that sign up before September get a special discount. And then once we hit 300, we're done for a while.
Yeah. Oh, that's amazing. Yeah, no, that's good to know. That's good to know because listen, you're only one woman, so you can only take so many, right?
I mean, I had over 4,000 at my last practice, and we're not doing that again. So
we're not too. Oh my God. That's actually staggering when you hear those numbers, 4,000 to 300. Well, thank you so much for being on today. I really loved our conversation. You're amazing. You're so fun to talk to. You're so knowledgeable, and I can see just like the joy radiating from you when you talk about your new practice. So I have no doubt that it is going to be super successful, and you are helping so many women to feel better and be more educated about their bodies and really thrive in this time of midlife, which is really what this is all about. So congratulations, and thank you for being on.
I mean, literally right back at you for everything that you do. I mean, I'm in awe of anyone that does podcasts. This is a lot of work, and it takes a lot of courage and everything. So I love listening to you, and I think you're doing a great job yourself.
Oh, thank you so much. Thank you.
Thank you.
Well, guys, absolutely. Make sure you check out Dr. Kim Einhorn. You can find her socials linked in the show notes, and be sure to follow me at Suburban Warrior on Instagram, TikTok, and YouTube. And let us know what you thought of this episode. Leave us a comment on Apple or on Spotify, because we would love to hear from you. We would love to hear what you think of this podcast, but also when you leave a comment, it really helps other women to find this podcast so we can get this awesome message out to the women who really need to hear it. We are trying to really focus on women in midlife, empower them, help them thrive, not just survive. And, we are redefining midlife wellness with grit and grace here at Suburban Warrior. So thanks so much. Be sure to listen next week. We'll have another amazing Suburban Warrior here to share her story. Until then, have a great week, everybody. See you next time.